On the blighted west side of Chicago, Devoy Boyd works for a hospital. He's not a doctor or a nurse and has never had any medical training. In fact, the reason Mount Sinai hired him was because he used to run with a gang and was shot multiple times. Today he's talking to 6th graders about staying out of gangs.
The purpose of our program is we speak to youth about the consequences of gang and drug involvement. So what we're going to do for you all today is I'm going to facilitate you all and tell you a little bit about what it's like to have a disability and some of the things that you have to go through on a daily basis if you get shot and acquire a spinal cord injury.
As reported by Barbara Martinez, Mr. Boyd and his colleagues at Mount Sinai Hospital have reached about 43,000 city children since the program started. It's one of the ways Mount Sinai Hospital, a non-profit hospital exempt from taxes, tries to fulfill its charitable mission.
It's committed to this community in a way that I think few other hospitals in the country have done. For example, we have a community outreach program that's more than a storefront handing out literature. It is 25 unique programs that deal with parenting, deal with senior citizens, deal with workforce development.
Mount Sinai struggles financially, however. 73% of its patients are either uninsured or on Medicaid, which is the government's health insurance program for poor people. With such statistics, caring for the poor becomes a challenge, particularly for the emergency room, where nearly 60,000 people show up every year.
I struggle every day trying to get volunteers to work in our emergency department. They come here a day or two, they see what the population is that we have to take care of. Even volunteers that come from the community. And they don't want to work here. They'd rather work at a nice place because it's a nice place to be.
Another big cost is theft.
I don't know why, but for some reason, patients steal them. And I don't know what they do with them, but they steal them.
Anything that's not secured to the wall or the floor walks out. This is how extreme it gets. You go in our bathrooms in the waiting room, there's no toilet paper. Why isn't there toilet paper? They stole the toilet paper.
These challenges have led some other nonprofit hospitals to give up and shut down their inner-city hospitals and focus instead on the more affluent suburbs. Mount Sinai's Mr. Channing, however, thinks that's a mistake.
And when I look across the country and see hospitals and health systems that have significant retained earnings and are wondering what to do with all that cash, I think there's a real opportunity to replicate what we're doing, to really create a community intervention program around a variety of areas.
For the Wall Street Journal Digital Network, I'm Matt Rivera.